Hey there, welcome back to another I Care for Your Brain with board-certified neuropsychologist Dr. Karen Sullivan. Today's topic is what is happening with Mitch McConnell, Minority Leader of the United States Senate. He has now had 2 instances of apparent transient neurological symptoms that have been characterized by altered mental status, difficulty speaking or at least responding, and staring. Each episode has lasted about 30 seconds and they have been separated by about a month. Now, unlike the first episode, the second episode, he whispered a very soft yes when he was asked if he had heard the reporter's question regarding his re-election bid. That was really the only difference, but I'm going to say these two were pretty stereotypically similar. His team and the press has characterized these incidents as freezing, a scary episode, a health issue, and his neurologist has released a statement, this was last week, saying that occasional lightheadedness is not uncommon in concussion recovery and can also be expected as a result of dehydration. Just yesterday, September 5th, the Capitol's attending physician, Brian Moynihan, said in a letter that Mitch McConnell did not suffer a stroke or a seizure and is not suffering from Parkinson's disease, and that he had been evaluated by a group of 4 neurologists with a workup including an MRI of the brain and a test called an EEG that measures the electrical activity in the brain, specifically when it is abnormal. So as I'm processing all of this information as a member of the public, my first thought, just as a layperson, would be absolutely, these are not occasional lightheaded episodes. This is not looking like it's dehydration. I think these look very clearly neurological. So when I put my neuropsychology hat on, wow, if this were to happen in my office, I want to give you my thoughts on how I would be writing this up, talking back to one of his physicians or neurologists. Now, I am not his doctor. I'm not a neurologist. I'm a board-certified neuropsychologist. And I can tell you through my education and my experience that there are 2 primary diagnoses to consider, and one I think is much more likely. So first we have the camp of seizures, and then we have the camp of transient ischemic attack, which we also call a TIA. What I think is most likely is that these episodes represent a subtype of seizure called an absence seizure or an absence seizure, if you want to be very fancy. This includes a sudden loss of awareness of one's surroundings, a lack of responsiveness. That clearly captures what we saw. We also have the possibility of a complex partial seizure. So what we see that adds a little extra flavor to these subtypes of seizures is we see automatisms. And what this can be is very subtle. You have to tune in, and if you watch the second episode, you can definitely see that there is some very subtle lip smacking that's going on. There is also in the August 31st video, you can see that not only is he staring intently with no blinking, but we can see that his right eye in particular is deviated out and up. So when we see that clinically, we start to think what's happening in the opposite side of the brain. So in this case, this would be the left hemisphere. So you can also see that there is a little bit of repetitive movements going on with his mouth. So this certainly looks to me like a non-motor seizure. These are more difficult to recognize and diagnose because they're called absence seizures. They are subtle. So many of us still think of seizures as a grand mal seizure, which is one type, but these absence seizures typically less than 1 minute, which the timeline here also fits. We have been reassured that the EEG was normal, but even when you go to the highest authority on these matters, which I would say is the Epilepsy Foundation, they report that during the seizure, yes, the electrical activity in the brain is abnormal, but once it's over, in the vast majority of people, we see that electrical activity goes back to normal. So if an EEG is not done very soon after, there's a big chance that we're going to miss it. And what we don't know here is is the timeline. We have no idea when he got the EEG. So if you get an EEG within 24 to 48 hours after a first seizure, you're only going to capture an EEG abnormality in about 1 out of 3, maybe 60 to 70% of people. The longer you go after the event, the less likely it is that you're going to pick up on any abnormality. So what he would really need would be what we call an ambulatory EEG, where he would actually be walking around with leads on his head, and he would carry a little button with him. And what we're looking for, the gold standard, would be a correlation between a push button event, which is when someone is noticing he's going into one of these spells, and then they would correlate it with the EEG to see if they can match up an abnormality. MRI is also not very sensitive to seizures. It doesn't show a seizure. It can show damage, especially the more seizures someone has, to help us locate where in the brain it's happening. It can also show us why someone is having a seizure. So that's the very first thing you think of in adults who are having a first-time seizure. You want to get them a structural brain scan, because what you're looking for is the issue that's causing the seizure. So most commonly in adults, we think about brain tumor, or we think about some type of bleeding in the brain that causes a high level of irritability. So this is another reason why I think we're looking at a seizure here, because we know that Mitch McConnell had a brain bleed. He had a subdural hematoma, also called an intracranial hemorrhage, in March of this year. So this was just about 5 months ago after he suffered a fall. So his type of brain bleed is in the layers of tissue called the meninges that surround the brain. So you've got skull, meninges, brain. And what I understand from reading in the news is that in that layer in between is where he had the bleeding. He's reported to have polio as a child, and he has difficulty, as he has said, lifting his leg to climb stairs. So this clearly puts him at risk for fall. He had a traumatic fall about 4 years ago in his home in Kentucky, where he broke his shoulder and had to have surgery. So we also know there's a history of multiple falls that have been what we would call traumatic. He also is reported to be on blood thinners, which then increase the risk of brain bleed from a fall. In March, he was in the hospital for 5 days of observation and treatment, and then back to work in 6 weeks. There was no brain surgery that I can see. He did not have to have a craniotomy to relieve pressure from the buildup of blood. That's very common. Any excess blood anywhere in the meninges, in the brain, is very irritating to brain tissue. It's what we call caustic, and it's very commonly going to result in someone having a seizure. So we call these post-traumatic epileptic seizures, PTS. And they're so common, in fact, that the vast majority of people are put on a prophylactic 7-day dose of anti-seizure medication to make sure it doesn't happen, because every seizure you have is going to result in some degree of additional brain damage. And that's not what we want for a brain that is already vulnerable from having a bleed. So after an absence seizure, and you can kind of see this, I think, in Mitch McConnell, is he is unaware of what has happened. It's almost like the hard drive has been rebooted. You get that impression from looking at the videos that he's not there, literally absent, and then all of a sudden he comes back. So after you've had these subdural hematomas, about 24% of people will have a seizure right around the time, and about 11% of people continue to have them if there is still a buildup of blood in the brain. So knowing he didn't have a craniotomy, we're going to assume that, he still has a little bit of blood product in his brain. This is very common. Blood does not break down and get removed very, very quickly in the brain. It definitely takes some time. The other possibility is that we saw a TIA, or a transient ischemic attack. It is estimated to be about between 250 and 500,000 people in the US alone will experience a TIA. It's the same underlying mechanism that we see in a stroke. Both are caused by a disruption to blood flow in the brain, spinal cord. We can even see them in retina. Don't forget, eyes are a part of the brain. Symptoms usually begin suddenly, just like his did, but the average length is longer. That's why I'm not thinking it's a TIA. So typically 2 to 15 minutes is common with a TIA. I think this was much too short. But we do see sudden confusion, sudden trouble speaking. So there's a couple factors there. We also can see trouble with seeing in one or both eyes. So we clearly see abnormal eye movement. So that's a possibility. But what we don't think is that a TIA necessarily follows the clinical pattern. So if I were to be seeing him clinically, I would know the history of falls, I would know the history of subdural hematoma, hemorrhage, and then I would clearly be thinking about seizure, specifically after observing one of these. So with a TIA, now he could have other risk factors that we don't know about: hypertension, diabetes, age, he's 81 years old, unhealthy diet, lack of regular activity, physical activity. He could have a family history of stroke or TIA. We also know that stress is a significant risk factor for TIA. And when someone has a hostile personality trait, this is also a unique risk factor for TIA. Just saying. So one of the biggest triggers for both of these conditions is lack of sleep, not taking your medicine like you're supposed to. And of course, these are factors that we have no insight or knowledge about. But what I am concerned about is that the workup does not feel convincing. What is concerning to me is that this is a person in a significant position of power who is of advanced age, who went back to work 6 weeks after having a significant traumatic brain injury. Now, that would not be something I would typically advise in someone decades younger than him. And certainly people of advanced age have a lot of capacity and ability to serve and to lead and to do very complex cognitive things. But I think when we have something like a subdural hemorrhage, and then we have multiple instances of what I consider to be a very clear pattern of neurological event, I think it's prudent for anybody to be concerned. There are growing questions about his ability to serve in the next Congress, which begins in 1.5 years. So the question is, how comfortable are we with this man leading a significant part of our government? We have a comment from Mitt Romney yesterday of Utah, who said even if this happened once a day and Mitch McConnell had a 20-second checkout every day, that he's still doing a pretty darn good job the rest of the time. But not all Republican senators were feeling the doctor's explanation yesterday. Republican Senator Rand Paul called the diagnosis inadequate and said that in his 25 years of medical expertise, this tells him this does not look like dehydration. So to me, it does not feel like we're getting a straight answer. It is very hard to trust the explanation of lightheadedness or dehydration. What do you think? What do you think as the general public? Does this look to you like something normal? Does this look neurological to you? Are you buying his team's spin on what this is? Are you buying the concept that it's just freezing? Do you think freezing is normal? I wonder what you think about this. Please share with me in the comments. And thank you so much for being here, and we'll see you next time.